Welcome to EuroPCR 2025. My name is Davide Capodanno. Today I'm particularly pleased to be joined by Dr. Kang from Incheon, South Korea, who presented a very important study that was simultaneously published in Neurointervention with a nice editorial by Thomas Cusset. And this is something that we discuss a lot. So ACS patients and the antithrombotic therapy in these patients. The name of the trial is 4D-ACS. Can you tell us who were the patients that you included in a trial like that?
The acute coronary syndrome and need stent implantation. Especially we implanted a drug-coated stent, and so that's the included patient.
So this is a relevant proportion of the patients that we see in practice, acute coronary syndromes, and of course the stent that you use in the trial was very specific. So one of the questions is whether, of course, these results will apply to patients with another stent as opposed. But I think here we have to concentrate on the antithrombotic therapy. Can you tell us what was the strategy that you investigated in the trial?
I'm not sure our strategy can apply to another stent. So I think the drug-coated stent is not, there is no polymer, so it's a very specific stent. So I think we need more data regarding we can apply this result to another stent.
And this was a de-escalation, no?
Yeah.
Which de-escalation did you use?
There are two methods for this de-escalation. So change to the less potent P2Y12 inhibitor, or another strategy is dose reduction. So our strategy is a dose reduction.
Okay.
And shortening the DAPT period, just 1 month.
So it's like you did the 2 de-escalation because you reduced the number of the drugs from dual antiplatelet therapy to single antiplatelet therapy, but you also reduced the dose of the drug from 10 milligram of prasugrel to 5 milligram of prasugrel. So this is pretty unique, let's say, in your trial.
So this is our rationale to combine both a very short, ultra short DAPT and then so dose reduction.
In ACS. And can you tell us what were the key results of this study?
The the MACE plus major bleeding. So after 12 months, the MACE reduced 44% in our 1 month group compared to 12 months group, and mainly driven by 79% reduction in bleeding. So without compromising ischemic safety. This is a key result to our study.
So the trial was definitely positive, and the main effect was because of the reduction in bleeding, with apparently no increase in thrombotic events. So it's an interesting strategy. Of course, the question is whether these results really apply to patients with the bleeding risk profile that you have in South Korea, which we know is different from patients in Japan, in China, but also from Europe, where we have another, let's say, trade-off between bleeding and ischemia. So thank you so much for sharing with us your results. Of course, I invite everyone to read the publication. And again, thank you for being here at EuroPCR and for sharing your science with us. Thank you.